like I talked about, you can think of vision correction broadly in two categories, right? So you have laser vision correction, and then you have lens-based vision correction. And the EVO ICL kind of falls in between the two, but more towards the lens-based aspect of things. So ICL surgery is an alternative form of vision correction to laser vision correction that does not involve reshaping the cornea or removing any corneal tissue. So the EVO ICL is a small, transparent, flexible, biocompatible lens that's a fraction of the size of a contact lens. And it just gently slips into the front part of the eye, behind the iris, which is the colored part of the eye, and in front of the natural lens in the eye. So when we're born, we're all born with two lenses in our eyes. And over decades of life, 4 or 5 decades, that lens starts to stiffen up, and that's what leads to the loss of near vision. And then over several more decades, the lens becomes cloudy, and that's what a cataract is. And so the ICL, while that natural lens is in place, just slips right in front of that natural lens. And it sits there, depending on the patient's age. If they're in their 20s or 30s, that ICL may sit there for a good 40, maybe even 50 years until the patient's in their late 60s and 70s and needs cataract surgery. And so it's a great form of vision correction that can be good for a lot of patients because it can correct not just low levels of nearsightedness, but up to very high prescriptions as well. It can treat prescriptions that are too high for someone to have LASIK to correct. And so it can correct up to about -16 and as low as about -3. And it can treat large amounts of astigmatism as well, up to about 4 diopters or so.